I'm joined today by Dr. Vienne Murray, a board-certified obstetrician and gynecologist from Richmond, Virginia. So we're talking today about health equity. Can you please tell me in your own words what the term health equity means to you?
So health equity means to me that we're able to meet the healthcare needs of individuals regardless of any physical, psychological, or socioeconomic status. I think sometimes we think of it just being as race, but it could be gender identity, it could be annual income, it could be any factors that would be giving folks one advantage over another. So being able to allow patients to have their best healthcare outcomes regardless of any of those factors.
There is some science out there that's looked at health equity and how disparities may impact people's outcomes. Can you talk about the evidence in OBGYN and how health disparities may impact outcomes for people?
Sure, it's really important. We really focus on obstetrical care because we see the greatest disparity in our obstetrical care because we know that half of births in the United States are from minorities. So we really need to focus on this data. I can't emphasize enough the importance of health before pregnancy and the importance of prenatal care. So if folks are coming into their pregnancy with other comorbidities, other medical problems, we're automatically going to see a poor outcome. So focusing on that, we see that patients who are Black have a higher risk of diabetes and obesity. We see that Hispanic patients have a 2 times higher risk of cardiovascular disease, so hypertension and things of that nature. We know, unfortunately, that patients who are both Black and Hispanic have a 2 times higher rate of mortality, of death related to some pregnancy-related topics. And then again, unfortunately, anything that happens during your pregnancy or before your pregnancy that would affect your pregnancy in a negative way is then going to affect your baby or has the potential to affect your baby. So we see an increased rate of infant complications such as preterm birth, which leads to smaller babies in general, and congenital anomalies amongst patients that are minorities. We furthermore, unfortunately, see an increased rate of fetal mortality and neonatal mortality of about 2 to 3 times in patients who are of Native American descent or who are Black patients.
So we've talked a little bit about what the evidence shows. Can you talk about what you've seen personally about how health disparities may have impacted outcomes in your career?
Absolutely. When patients come in, again, without good prenatal care or without management of medical problems before they get pregnant, we see those outcomes run through their pregnancy and then to their babies as well. Some cultures really value a C-section over a vaginal delivery, and I think lack of that recognition makes us not talk about it. And so then we're in the labor and delivery suite struggling over how to deliver a baby. So having a conversation about that and having some education well in advance and making sure we're on the same page is extremely important. There are also certain cultures that really value having certain genders of providers in their delivery room. And again, having that conversation beforehand and making sure we're meeting expectation is hugely important. The definition of family has become much different for us these days than they were 20 years ago. And being sensitive to the topic of gender identification is hugely important for us. Unfortunately, I think we have lost trust of some of our patients at times because we don't identify their preferences. We make assumptions like, where is your husband, as opposed to where is your partner, or where is your support person. Just being cognizant of those changes and differences goes a long way with patients.
So what would you say caregivers, physicians, nurses, others can do to educate themselves or become more aware of the challenges patients may be facing because of health disparity?
I think we need to really get to know people and to ask the right questions. We need to be curious. We need to not be afraid of asking our patients questions. We need to not be afraid of acknowledging differences and that disparity. I think when we don't acknowledge it, we give it more power, and acknowledging it will help us to work through that disparity. So I think really just being honest with your patients and asking them questions and asking them how they feel and giving them more power to talk about what they see as a change in their healthcare. I think it's also important that we acknowledge the fact that there have been some reasons for patients to mistrust the medical community and to work even harder to develop that trust. We take the time to ask questions and acknowledge the differences and what may or may not have gone well in their past prenatal care or other just healthcare in general. We can work more diligently on establishing a better relationship.
From your perspective, how can physicians demonstrate to their patients that they're aware of and sensitive to the health disparities that may exist?
Absolutely. I think one thing that really has been powerful in our office is having a questionnaire. So patients feel comfortable not having to verbalize things, but they can write it down on paper. That's where we've seen or we've gained a lot of ground on knowing gender identification in our office, is that sometimes patients don't feel comfortable with that, but they are willing to put it on paper. So that gives us a huge advantage on being able to know what's going on without having to maybe address a sensitive topic. I think being curious is very, very important. I think the more we ask questions, actually instead of it seeming embarrassing, which is sometimes what we feel, it really actually makes the patients feel like, wow, they really care. I also think we have to look at our data. We have to be looking at our data to see where we're doing well and where we don't. Again, I think sometimes we're afraid to look at our data because we're afraid we're going to see things we don't want to see. But getting that data is really important. The more we can acknowledge the dimensions of diversity, the better that we will be in our healthcare.